Hello, good afternoon, everyone. Yes, B, please, you start.
Okay, is Ahava going to be speaking today,
Yes,
right after me?
yes.
Okay, great. Okay, so here we go. B. Coleman here. And again, I am not a homeopath. I'm just an avid homeopathy person. Today we're discussing kidney-related issues. So we're kind of going to be all over the board, I think. I think I'd like to start first with my own issue, which I don't know if you call it kidney failure, but I do know that ever since 1976, I have suffered from kidney infections. They would first come every 10 years, then every 7 years, then every 5 years. But once the dreaded C started 4 years ago, it was coming every year. So something got tweaked in there. And then in 21, I got a massive combo of cystitis, kidney infection, and a UTI. So I was in a world of pain. Before then, I was able to stop my kidney infections without medical intervention, just by using a product called cholesterol-LD by Sovereign Laboratories. Awesome, amazing stuff. I would just take a tablespoon every hour on the hour. And the first time I did that, I was done in 5 hours with a severe pain. You, of course, have to keep treating it, but the severe pain was gone. The following year when it happened, I did 2 tablespoons every hour. And I was literally done with the kind of severe pain that lands you in the ER. I was done with it in 2.5 hours. Again, you have to keep treating the kidney infection, though. So after this massive incident in 21, I realized that something had gone wrong, that my kidneys were now in worse shape, probably because of the whole dreaded C thing. And I added Cytozyme KD. It's by Biotics Research. Awesome, awesome. It's not homeopathic, but it is an awesome tablet. Dr. Tent is a naturopath, and I learned that from him off of some videos. And he went to help a friend of his in the hospital and was helping him with his kidneys. He was on dialysis, and after, I want to say it was 8 days, the guy was off of dialysis. So that's a good product to have in your back pocket. So after that big incident, I decided that it was really time to address my kidney deficiency, whatever was going on. It was a wake-up call. And so I took 2 Soham remedies and I combined them as one. The first Soham remedy, SOHAM, is called Kidney Balance. It is also called BR11, and that is in a 50 m potency. For those of you that have rate machines, remedy machines, the rate is 223578, and then you select the 50 m potency. The second remedy that I joined with that one is called Soham Mixture S Kidney 30. The rate for that one is 8, 8, 9, 10. That is a 10 on your dial. That is not a 1 and a 0 separately. That's a 10. This is working extremely well for me. I have noticed great improvement in my overall kidney health. I am still using it because I still test positive for the remedies. And I am ecstatic that I am finally healing my kidneys. The next is polycystic kidney disease. This particular protocol was posted by the doctors Banerjee in the BP users group somewhere around December 1st or so of 2022. It consists of Meteorinum 200C, and that is twice a day. The other remedy is Thuja 30C, and that also is twice a day. I assume those are taken separately because they did not indicate that they were to be taken together. The next issue, renal cysts, but this also covers BPH, benign prostatic hyperplasia. And this was previously posted by Dr. Imran, and this was not on his paid group, of course. It consists of two remedies, Thuja 200C and Apis Mel 200C. These are taken together twice a day. Again, this is for renal cysts and BPH. Now, next is the Banerjee protocol for kidney failure. For those of you that have the book, that's on page 135. The first line protocol involves three remedies. You're going to do all of the following things. First, Meteorinum 200C once every other day. The next part of that first line protocol is you alternate these two remedies every 3 waking hours. That is Lycopodium clav 30C and Cantharis 200C. Those are alternated every 3 waking hours. The third part of that first line protocol is aconite mother tincture twice a day. Second line protocol for kidney failure, EEL serum, EEL serum 30C, once every other day. You also alternate the following two remedies every 3 waking hours. That is Lycopodium clav 30C and Cantharis 200C. Again, alternated every 3 waking hours. And the third part of the second line protocol is, again, aconite. 3 drops, by the way, is their dosage for the aconite mother tincture, and twice a day. Now, on the notes to these protocols, it says that you can increase the frequency of the doses if the symptoms are truly severe. Also, for nausea, vomiting, and labored breathing, they recommend arsenicum album 6C every 15 minutes if acute, and then less and less often with improvement. I've been looking into the Rekweg drops, RECKWEG. Rekweg drops are 18. They are called kidney and bladder drops. You can purchase that online. And if you have a remedy maker, the rate is 86323. It contains Berberis vulgaris 4X, Cantharis 4X, Dulca mara 4X, and Equisetum, I don't know how to pronounce this, Hyemale, Hyemale, in a 6X, and Eupatorium perp 3X. You can make that up yourself if you have a remedy maker. Let's see. So we got kidney renal cancer. This is from the additional Banerjee protocol book, page 56. So it's not the main book, it's the additional one. It consists of Thuja 30C twice a day and carcinosin 30C every other day, once every other day. These are taken separately. The Banerjees recommend using the kidney failure protocol that I discussed earlier alongside this kidney cancer protocol. That is all I have, folks. If you have any questions, please speak up. Otherwise, at this point, I will introduce to you, hopefully she's on now. Let me see if I see her. Ahava, are you on board? I'm not sure I'm seeing your name here. I don't think I do. She might be running late, folks. Dr. Imran, would you like to proceed? I don't believe she's on
Yes.
yet. Great, thank you.
Okay, welcome. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, everyone, and good afternoon. Here is Dr. Imran from Pakistan. So today we talk about kidney related issues. And first I talk about symptoms of kidney stones. Kidney stones usually cause no symptoms till the time they do not move around in the kidney and pass through ureter. If a kidney stone is located in the ureter, it may cause urine blockage, resulting in swelling of kidneys and spans of ureter, which can be very painful. At that point, one may experience the following symptoms. Number one, severe sharp pain on the sides of abdomen, flank area or in the kidney region, in the back below the ribs, medically called Leucan's area, is termed renal colic. The pain travels to lower abdomen and the pain often started suddenly and comes in waves. The intensity of the pain second, pain or burning sensation while urinating, need to urinate again and again. Number three, urine is dark or red, cloudily due to blood in it and full smelling. Sometimes urine contains small number of red blood cells, cannot be seen with naked eyes. So next I talk about what are cause of kidney stones. Number one, low urine volume. Less volume of urine is a key risk factor for kidney stones. Dehydration, loss of body fluid throughout activity, rising in a warm, humid environment, or not drinking enough fluid can contribute to low urine volume. Black urine, there is the less fluid to keep salt dissolved in the urine. Number two, diet. Diet can have a impact on stones and the like food of developing them. High calcium level in the urine is one of the most common cause of calcium kidney stones. They The body metabolism of calcium may be blamed for high urine calcium levels. The most typical type of kidney stones, calcium oxalate, contains oxalate. Consuming foods high in oxalate increase the chance of developing these stones, and excessive intake of animal proteins in the diet, such as beef, fish, poultry, and pig meat, can cause the acid level of the body and urine to rise. The formation of calcium oxalate and uric acid stones is facilitated by high acidity levels. The The likelihood of developing calcium and uric acid stones in further increased by uric acid formation from the breakdown of meat. Number three, obesity. A risk factor of stone which may alter the urine and acid composition, which could result in the production of stones. Number four, family history. The risk of developing kidney stones is high in those who have family history of kidney stones. Number five, medications. The chance of developing kidney stones increase with intake of certain drugs as well as calcium and vitamin C supplements. Number six, chronic UTI. Larger kidney stones can develop in those with chronic urinary tract infections. These are frequently referred to as steroid stones. Number seven, bowel conditions. Certain bowel conditions that cause diarrhea, disease, and ulcerative colitis, and like gastric bypass surgery can rise the risk of formation of calcium oxalate kidney stones. Diarrhea may result in loss of large quantity of fluid from the body and decreased urine volume. The body hence absorbs the excessive oxalate from the intense, resulting in more oxalate in the urine. Both low urine volume and high oxalate in the urine can lead to the formation of calcium oxalate kidney stones. So, type of kidney stones. Calcium stones, 80% of the stones, these are most prevalent kidney stones. Calcium oxalate and calcium phosphate are the two different forms of calcium stones. The most typical kind of calcium stones in by for calcium oxalate. In some cases, urine contains excessive amount of calcium, increasing the risk of calcium stone in the contains excessive amount of calcium, increasing the risk of calcium stones in them. Calcium stones can develop due to various the other reasons also, even when there is normal calcium in the urine. Number two, uric acid stones. This is yet another typical kidney stones type. Intake of large amount of animal protein can increase the risk of uric acid buildup in the urine. Uric acid crystals do not dissolve well in acidic urine and can lead to the formation of uric acid stones. Loss of body fluids due to diarrhea and certain genetic factors may be person prone to developing uric acid stones. These kinds of stone frequently develop in persons having a family history of stones. Steroid stones. These stones have a connection to present UTI tract infections. Some bacteria increase the urinary basically of alkalinity, decreasing its acidity. Magnesium, ammonium phosphate stones develop in urine. That is, these stones frequently have branches are huge and develop quickly. The greatest risk of developing these stones in the those who frequently experience urinary tract infection, UTI, those who have long tubes in their kidneys or bladders, or those who have poor bladder emptying as a result of neurologic conditions such as paralyzed multiple sclerosis and spina bifida. And number four, stagnant calculus. The term stagnant refer to the shape of this type of stone which has branches like a piece of coral or the entrails on a pupil, deer pupil having repeated UTI and more prone to develop this type of stone. If they form as a result of infection, they may be made of steroid, which is mix of magnesium, ammonium, and phosphate. If they are formed as a result of smaller stones growing larger over a period of time, then the stagnant calculi are made of calcium oxalate, calcium phosphate, or a mixture of calcium carbonate, apatite. Apart from steroid, the way the branches of this type of stone grow, it can block the pelvic and the clice of the kidney, which can lead to kidney failure. So now I want to talk about some homeopathic remedies which we are commonly use in our clinical practice for kidney stones. So first remedy is Berberus. First remedy is Berberus. Berberus is one of the top listed remedy for kidney stones. Formed on the left side are unique symptoms guiding the use of Berberus. Is pain in left kidney that radiates down the ureter and into the urinary bladder. The pain can be shooting, stitching, cutting, or stinging in nature. The pain may worsen by any kind of movement, especially jarring movement. Urinary may be yellow and may contain slimy sediment. The area around the kidney is sensitive to touch. So we are used Berberus in mother tincture, Berberus in 1x, and Berberus in 2x, Berberus in 3x, and Berberus 30C and Berberus 200C according to the patient condition. Second remedy is lycopodium. Second remedy is lycopodium for right side kidney stone. Lycopodium is an outstanding remedy for treating kidney stones on the right side. It is indicated when there is pain in right kidney and right ureter. The pain gets worse before urination. There is forceful stooning and urine is snatty. The kidney pain subsides after urination. The urine may contain red sediments. Also, the urine may be containing pus, turgid, or pale in some cases. We are use Lycopodium 30C, Lycopodium 200C, and Lycopodium 1M according to the patient condition. So third remedy is hydrangea. Third remedy is hydrangea. Hydrangea is popular known as stone breaker. Hydrangea is used to crush kidney stones in ureter as well as bladder. If some notices white or yellow sand deposits, then hydrangea in well indicated soreness in the kidney region may also be felt in such cases. In some cases, blood may appear in urine. We are use hydrangea in mother tincture, hydrangea in 1x, hydrangea in 2x, hydrangea in 3x, in 30C and 6C according to the patient condition. So fourth remedy is cantharus. Fourth remedy is cantharus for kidney stone with burning urination. Cantharus is one of great help in kidney stones where there is an intense burning on passing urine. The burning sensation may also be felt before urine pass and may continue after urination. Another attending feather in is kidney pain. With frequent urge to pass urine, bladder may also be marked where the urge to pass urine is almost constant along with unsatisfactory urination. Urine may contain jelly-like mucus. So we are use Cantharus in 30C, Cantharus 200C, and Cantharus 1M according to the patient condition. The key indication feather of this remedy is cutting and intense burning in the entire renal area. So we are use Cantharus 30C, Cantharus 200C give amazing results where burning is severe. Repeated dose of 30C potency can be consumed. So fifth remedy is sarsaparilla. Fifth remedy is sarsaparilla for kidney stone with burning at close of urination. Sarsaparilla is the best remedy that you can count on the cause of kidney stone with excessive burning at the close of urination. The urine passed is snatty and may contain slimy or sandy particles. Sarsaparilla is also suggested for right-sided kidney stone. So we are use sarsaparilla in mother tincture, sarsaparilla 1x, and sarsaparilla 30C and sarsaparilla 200C according to the patient condition. Next remedy is Argentum nitricum. Argentum nat or Argentum nitricum. This remedy is used where a patient experience due to kidney congestion or from the passage of stone, dull itching is experienced at the back of the bladder, and the urine is dark, containing blood and deposits of renal epithelium and uric acid. Urine passes little at a time, usually in drops. The patient's face becomes dark and dry. The urine burns during passage, and the urethra feels like it is a swollen. So we are use this remedy in 6C and 12C in 30C and 200C according to the patient condition. Next remedy is belladonna. Belladonna, it is used when the kidney stones are accompanied by sharp and shooting pains. Sudden cramps and strains along the ureter during the passing of urine are likely. The patient may feel feverish and excited irritation, calculating, and cramps are likely to occur as well. So we are use belladonna 30C and belladonna 200C and belladonna 1 m according to the patient condition. Next remedy is benzic acid, acid benz. Benzic acid. This homeopathic remedy is used in case of stones with offensive urine. The urine is deep red in color and the urine is deep red color and has a strong odor. It may smell. The urine is thick and water like clear. In an alternative way, the patient usually feels better when the urine is thick and profuse. So we are use this remedy. Benzoic acid, 3C benzoic acid, 6C, 12C, 30C, and 200C according to the patient condition. So next remedy is osmium ken. Next remedy is osmium chem. OCIMUM, osmium ken. Kidney stones associated with nausea, vomiting, and pain indicated this remedy. It offers remarkable result in treating the right-sided kidney stones. We are use OCBM can 30C and 200C, and in some cases we are use this remedy in mother tincture and in 1X according to the patient condition. Next remedy is tobacco. Next remedy is tobacco. Tobacco. This remedy is indicated for left-sided kidney stones with nausea and vomiting. It helps in treating the patient who passes red or saffron colored urine and experience burning, painful bladder, we are use this remedy in 30C and 200C according to the patient condition. Next remedy is terebinthina. Next remedy is terebinthina. Terebinthina is of immense help in case of burning, drawing pain in the kidney. It is accompanied by dark, cloudy, or smoky urine, which contains albumin and coffee ground sediments. Constant may also appear with these symptoms. So we are used terebinthina in mother tincture and in 1x, 2x, 3x, 4x, 3C, 6C according to the patient condition. Next remedy is Apis mellifica. Apis mellifica, when the persons complain of kidney filling sores and bursted pain from pain, the person also complained of burning, stinging pain in the urethra while urinating. In such cases, urge for urine is frequent, but natty urine is past mark is also observed in cases where Apis mellifica will work as the most effective among her homeopathic remedy for kidney pain. So we are use this remedy in mother tincture 1x, 2x, and 30C and 200C and 1M according to the patient condition. Now I want to share some homeopathic a protocol which we are use common use in our clinical practice for kidney stone. These are a successful. So first protocol is for stone in kidney, Silesia 6x, Magnesia Phos 6x. Mix together these two remedies and use 3 times a day and Berberis BER BERIS Berberis in mother tincture 10 drops 3 times a day in half cup of water before half hour meal. And if feel pain, kidney pain, then we are use Aconite 200C and Belladonna 200C. Mix together these two remedies and use 3 times a day.
Dr. Imran, what was the remedy right before Mag Foss?
Silesia.
Okay.
Silesia.
Okay, thank you.
1 minute. Protocol for kidney stone. So next protocol is next protocol is Berberus in mother tincture and Prera breva in mother tincture and
What was that second
Thalaspi
one?
bursa
What was after Burbus?
Prera breva.
Would you spell?
Prera breva. I write. Don't worry, I write. Prera breva in mother tincture and third remedy is Thalaspi bursa clupsa
I think you're going to
in
have to
mother
write
tincture.
that one too.
Yes. First remedy is Berberus in mother tincture, Prera breva in mother tincture, and Thalaspi bursa clupsa in mother tincture. Mix together these three remedies and use 20 drops 3 times a day in half cup of water before half hour meal. This is my successful case in kidney stone. So I almost 200 plus uh, kidney stone patient recover with this protocol. Berberus vulgaris in mother tincture, Prera breva in mother tincture, and Thalaspi bursa clupsa in mother tincture. And if feel pain on backside, then we are use Aconite 200C and Belladonna 200C and Arnica 200C. Mix together these three remedies and use every 10 minutes, one dose until pain gone. If pain goes to if pain goes to lower abdomen, upper side, lower abdomen, then we are use Aconite 200C, Belladonna 200C, and Colocynthis 200C. Mix together these three remedies and use 3 times a day. So my next protocol is Berberus vulgaris in 200C, Lycopodium 200C, and Hydrangea 200C. Mix together these three remedies and use 3 times a day. And one more protocol is in biochemic. Calcarea fluor 6x, Coliphas 6x, Silicea 6x, and Magnesia Phos 6x. I repeat again, Calcarea fluor 6x, Coliphas 6x, Silicea 6x, and Magnesia Phos 6x. Mix together these four remedies and use 3 times a day. And Berberus in mother tincture 10 drops 3 times a day in half cup of water.
Did you say 10 drops or 20?
10 drops 3 times a day. So if anyone have a question about this topic, so I'm here to answer.
So you said aconite 200, belladonna 200, colocynthis 200, and that was for what?
For lower abdomen pain, first I share a protocol. If pain goes to backside, then we are use aconite 200, belladonna 200, and arnica 200. See. And come to uh, if pain comes to a lower abdomen, uh, then we are use aconite 200, belladonna 200, and colocynthis 200.
How often?
Uh, every 30 minutes, one dose until pain gone.
Thank you.
Okay, always welcome. Anyone have another question? Anyone have a question?
It appears that we do not. That was excellent information, Dr. Imran. Thank you so much.
Thank you very much. Okay, so thanks very much to everyone. Next Sunday, we again meet same time with new topic, and God bless you all. Have a good day.
Thank you. God bless you.
Okay, bye bye.